Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I am thrilled to have Dr. Lucas here today with me for this episode of Ask the Patient Advocate. In the current age of healthcare, it's so important to have an advocate to help navigate for you and your loved ones. And part of advocating is having the proper resources to support your diagnosis and management. Our episode today is focused on navigating the complexities specifically of endometriosis. And Dr. Lucas and I share the same mission to help people navigate their healthcare challenges. Dr. Lucas is a board-certified gynecologist and the founder of the New England Center of Pelvic Health. He has years-long vision for a clinic where patients suffering from pelvic pain and endometriosis could have access to comprehensive evaluation, accurate diagnosis, and thorough care tailored to the patient's experience and goals. We will talk more about it in just a few minutes. So, Dr. Lucas, thank you for joining me today. And how are you doing?
I'm doing well, and I want to thank you for having me today. And also thank you for the advocacy work that you're doing on behalf of your patients. Very much appreciated for not only for patients, I'm sure, but the providers who are providing this care to be able to be connected with patients. There's not always an easy or direct way to do that. So I thank you for your advocacy work in that regard.
Oh, thank you so much. Yes. So I came across Dr. Lucas initially when I was researching for one of the clients that I'm a private patient advocate for. And I've had so many clients over the years that really have struggled with their endometriosis, just really finding someone that's going to listen to them and offer a plan and really be interested in being with them long term. So when I met with Dr. Lucas for the first time, I was amazed at his my interaction with him, his response, and his whole process seems so beneficial to all of his patients. And I really wanted to share that with everyone because I think it's such a great tool and it's important that everybody knows what he can offer. So that being said, Dr. Lucas, could you please begin by sharing some insights into your background and experience with endometriosis?
Yeah, certainly. Well, I'm a board certified OBGYN. I was trained as an OBGYN and I practiced as a generalist OBGYN for about 11 years after finishing my residency. Actually, hold on a second, guys. Give me a second. I got to do the math again. 2013. About actually 9 years after my residency. It's funny, as time goes on, it becomes a bit of a blur, but uh, during the course of being a generalist, though, a few things, and even during my training, a few things kind of stood out to me. And it was that, you know, the education and our ability to treat patients for, pregnancy and complicated pregnancies and, bleeding disorders, menstrual disorders, even cancer, pretty good at that. But I just felt like there was something really lacking with our ability to appropriately diagnose and then therefore treat patients with pelvic pain. And I just kind of felt like there was something lacking there. And moving down the that line of treating patients for pain, it came into contact with very often patients who have pelvic pain. Not always, but very often, there's endometriosis included in that. So I started to kind of do some of my own digging into endometriosis and, why is it that it feels as though I felt as though our outcomes, I was really dissatisfied with the outcomes that we were getting for endometriosis surgery or even much less outcomes with treating endometriosis hormonally or medicinally. I just felt like we weren't doing a great job. So I started to kind of, delve a little bit deeper, and I met some experts in endometriosis surgical care. But even that, as really effective as I could see that was, I was also noticing that even after surgery, patients have, in some circumstances, continue to have flare-ups. So to me, it became apparent that we need to do better with regard to addressing pain, and if the pain is from endometriosis, we need to do a better surgery. And even after surgery, we have to offer these patients longitudinal, long-term solutions for how they can address pain that may persist, even though the initial inciting inflammatory, tissue has been removed, right? So, coming from a background of being an osteopathic physician and previously having been a chiropractor, I approached the pelvis in a way that was looking at all the different systems and structures that live within the pelvis that interact with each other, that are not necessarily or specifically outside of the purvey of gynecology. So just having that global view of everything that lives in the pelvis, not just gynecology, and how endometriosis and pelvic pain can incorporate multiple, and often does incorporate multiple systems simultaneously. That was my welcome into this world, and now I do it all the time.
That's wonderful. And I think, one thing that you said specifically stood out for me because so many patients will tell me, like, I'm scared to go through with surgery because then what's going to happen if it doesn't work? And you had mentioned like a long-term management plan. You're not just offering them surgery and then good luck type of thing. It's not, many people have still have recurrence or problems after surgery. So I think that's really important for people to know that there is help after surgery if needed. Um, so that being said, you talked a little bit about, why you got into specifically focusing on endometriosis and pelvic health. Can you tell us a little bit more about when the New England Center for Pelvic Health was established and a little bit more about that specifically?
Sure. New England Center for Pelvic Health. We're in Freeport, Maine. We opened our doors in February of 2023. I had, for a couple of years, at least 4 years before that, had this idea swirling in my head about how we need to have a more comprehensive assessment and therefore treatment of pelvic pain. And being a generalist OBGYN didn't really leave me with the resources and the time that I felt like I needed to be able to really focus on these problems. So I started kind of coming up with an idea for what a clinic might look like and what are the the tools that I would need, the staffing that I would need, literally the space that I would need to be able to do that full time. So the need for a dedicated space, a dedicated tools, and the time and the freedom really to be able to see patients to the extent that they need to tell their story, to explain all of their symptoms. There's the patients with pelvic pain not only have pelvic pain, but they have pelvic dysfunction. So you need to allow for patients to really get out all the individual complaints and dysfunctions that they have. And so I knew that I needed to have a place that was going to be specifically dedicated to that. And along the lines of what you, Dr. Borelli, I also wanted to have the opportunity to build a network of different providers in different disciplines and different specialties throughout the area so that if a patient comes in and has a complaint that's a pelvic complaint that's outside of my scope as a gynecologist, I could be an advocate for them and get them out to the appropriate provider in a quick and direct way and be able to communicate with providers and say, hey, listen, I've seen this patient, I've done the examination, I very strongly feel that this is what their diagnosis is, but I can't intervene. But I'd like you to see this patient. I've done a lot of the work for you. This patient has suffered long enough. Let's see if we can kind of expedite more targeted evaluation and or treatment from a specialist within that particular specialty. So, for example, like vascular or neurologic blocks under diagnostic imaging guidance, right? So that was kind of where I felt that I felt like that type of facility or clinic needed to exist, and I didn't really see it existing, so I figured that now was the time to build it.
That's amazing. That's wonderful. I'm sure so many people are so appreciative that you took that initiative. So with the Center for Pelvic Health, do patients have to see like a generalist OBGYN first and then secondary, or can they, do you need a referral from a OBGYN, or can they come straight there, if they have endometriosis or pelvic health issues?
I think often that's directed by the constraints or guidelines put forth by individual health plans or third party payers.
Sure.
So that might be something to discuss, if a patient is interested. But I will certainly we'd be more than happy to see patients who come in either through referral or who find me online or otherwise and want to come in. There's also patients who, before committing to either a telehealth appointment or an in-person visit, would like to know if they think I can help. And in those circumstances, really anyone can feel free to get in touch with our office and have their medical records sent over, and I can do an initial evaluation of the patient history, and I cannot offer specific instructions or recommendations, but I can certainly say whether or not I think that it would be beneficial for us to have a secondary conversation that might be more targeted, more pointed, with recommendations or interventions for care.
Sure. No, that's amazing. That's super helpful, in situations like that, that you're actually able to at least give some, initial recommendation as if it's worth, for them to continue to pursue that route and further investigate. That's wonderful.
Mhm.
Now, do you feel that patients, when they come to you with the complex conditions like pelvic pain or endometriosis, do you feel that the majority of them know what a private patient advocate is? In many states, it's kind of a newer concept, and the name is kind of it could be a little bit confusing because it's shared with many other things that have a little bit different of a profession. So I'm just curious, are patients typically familiar with what a private patient advocate is?
No, and I apologize because I immediately jumped out of the gate. It's, no, 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 they don't. Uh, and so yeah, there it is. No, I'm going to be honest with you. As a provider
Yeah.
and a patient, and a person on this planet who needs to see doctors every now and then as well. I had no idea. While investigating, how patients come into contact with providers that are specialty focused, or whether it's a region or a specific disease. That's how I came across a private patient
Mhm.
care advocacy. And so I can tell you that I don't think I've ever, I'm going to be honest with you, Dr. Burley, I don't think I've ever had a patient come up to me and discuss private patient advocacy. So, in my travels and my meanderings, I came across you and your profession, and I think it's great. And I think that we have a lot in common, kind of like I've already alluded to, where patients come in and I feel like I'm a bit of an advocate, from a medical standpoint, and an understanding, saying like, hey, listen, I'm glad to see you. I'm glad to meet you. I'm glad to understand your problem. And I'm very glad to get you. Unfortunately, I cannot help you, but I'm happy to get you to someone who can.
Sure.
And, I do that as a provider, but the idea that there are private and independent, folks out there like such as yourself who are helping patients to navigate and get them to where it might seem most appropriate for them to be, or to get them to the resources that might be most likely to help them is really great. I think we need more of that.
Thank you. Yeah, it's funny because so prior to going into private patient advocacy myself, I was working as a PA in the hospital for like 13 years. And I
Hmm.
kept saying to myself, like, I wish, one day I want to do this job where I can like advocate for patients independently. And like, I kept thinking it more and more, like with every, person I'd run into, I'm like, I wish that I could do this one day. And so when I finally like started looking into it, I was like, wait a second, this is actually a profession. I just never knew about it. So
Yeah.
it's kind of interesting that, so, it's still a fairly new concept in many states, and even the states where it's been around for a while, there's still pockets that don't really, know what services they can help with, and then, how they can help. So I feel like, I continuously learn things every day too, but I'm glad that more and more people are starting to include private patient advocacy in the care teams.
Yeah, I'm happy to see it, and I think that you having been in in that healthcare system, these things aren't intuitive, right? I mean, patients don't know this, and I don't expect them to. I mean, I know this because I've worked in hospitals for a long time, and I've been in various aspects of healthcare, right? And and now I'm in a slightly different aspect of healthcare, right? Private practice, but we understand how the system works. We understand, you know, to varying degrees, how third party payers and insurance work, or Medicare or Medicaid, and we also understand the language that physicians or nurse practitioners or or PAs use, other healthcare providers. We understand the language that we use and what we kind of look for. And I think that sometimes patients who are not, in medicine, don't always understand that nuance. And so I think it's helpful to have somebody who's an advocate who can, again, speak the same language and describe circumstances in a way that might get patients to where they need to be a little bit quicker.
Exactly. And I think too with healthcare, working as like a provider in healthcare, it's so or any really having any role in healthcare, it's so fast paced. You're constantly, there's always time constraints and it's almost like the day is always too short. And so I think, I remember not being able to spend as much time with as many patients as I wanted to because I had other patients to go to and things like that. And so maybe at that point, some patients didn't have the enough time as they wanted to ask questions or double check and things like that, where I think the benefit a lot of times of a private patient advocate is like, I know for me, like beforehand, when my clients have an appointment, I sit down with them and like think of, okay, these are the what questions were you thinking of asking at this appointment? And what are which out of these questions, like which are the most important to you? And how can we basically use your appointment most efficiently without like running over on time and respecting the provider's time and things like that. So I think going in, they have a little bit more of an idea of like what the expectations and possible things they would get out of that appointment. And then I think they just feel also a little bit more organized going in. So it kind of helps the appointments go a little bit smoother in most cases. So
Yeah, that's great. I mean, you're effectively serving as a bridge, right? So it's quite useful and very helpful. So yeah.
thank you.
Mm.
So what aspect of your work do you find most fulfilling or enjoyable?
Oh, yeah, so many, and I know, like I scoffed, like, oh, and in a good way, because it's very much like, where do I start?
Mhm.
Uh, I do this, and I dedicated myself to doing this full time, all day, every day, because I really feel strongly that it needs to be done, and I know that there is an unmet need, but I also find it very enjoyable, quite fulfilling, and that's my biggest take home, and it really is for a number of reasons. But to really narrow it down, because I'm sure we have only a certain amount of time, and I don't want to completely and utterly bore the audience. But I mean, I think the biggest thing for me is it's making a real and lasting impact on patients that so often, by the time they've come to me, they've been let down by previous interventions, previous surgery, previous medications, previous whatever. They're just they're exasperated so very often. And really often they feel neglected or dismissed. There's something wrong with you. I don't know what it is. I can't figure it out. I can't help you. And that's not castigating or really speaking ill of anybody else. It's these things are complicated. These pain syndromes are complicated. You have a location in the body that has a lot of different interactions, um, and a lot of things can go wrong. And again, they almost never exist in a vacuum. If you have one system that's not functioning well, that very often spills over to one or more. And that's frustrating for the patient. It's frustrating for specialists who can't really put a specific finger on the one keystone linchpin, you know, that one dysfunctioning, pain causing structure.
Sure.
So, being able to intervene for these patients who have felt really let down, neglected, dismissed for so long, and being able to make an impact there uh, is really super satisfying. It's also, if I can keep going, tell me to
Yeah.
stop whenever, but uh, it's developing an individualized, multifaceted, long-term care plan for patients with complex multifactorial pain complaints. I know that's not just like, spin the wheel and see how many adjectives we can get. But really, I do mean all of them. And I can't really get it across unless I say all of these things. It's seeing the person, the individual in front of you, appreciating their specific experience. And then saying, listen, we're going to develop a robust intervention plan here because, again, there are multiple systems and they're dysfunctioning in a number of different ways. So the thought of, hey, fix your pelvic pain with this one weird hack, that's not a real thing. They're here because they have a multifaceted, multifactorial problem that's going to need a multifactorial answer. And the long term aspect of it is, hey, we're not going to just fix this and it's like, great, we're good, that'll do it. I have to develop for these patients, this is how I'm going to get you feeling better. And the next thing is, how do I keep you feeling better? And what tools, in case of emergency break glass, options can I give you in the event that you have a flare up? Because you're going to have flare ups, right?
Yeah.
The key is understanding that you're going to be okay. And these are the things that you can do to get you back to baseline. And these are the markers, these are the red flags that say, you know what, I need to be in touch with someone. And guess what? In my particular clinic, I am that someone. I tell patients, listen, I am here to be a resource for you in the event that you have so much pain that you can't get out of it. You shouldn't feel ashamed or disappointed, or like you're disappointing me if you need to get in touch with me because everything that we've done so far isn't working. You need to feel comfortable saying, I'm not well and I need your help. And I know we've done so much, but I think I might need something more. So being able to provide patients with that whole spectrum of care is really, really fulfilling. It's really, really hard, but like most things that are difficult, it's really worth doing, right?
Yeah, exactly. No, you are correct. And that's amazing that you're able to provide patients with a tailored approach that addresses their specific and diverse needs for every single patient. I think that is definitely the key of what patients, especially with complex issues like endometriosis, are looking for. And clearly, you can tell just from talking to you during this podcast that you are very compassionate about what you do, and I think that your patients feel a sense of trust. They build a trusting relationship with you, and I've run into a lot of patients where they'll tell me like, oh, I don't want to ask my doctor that or tell him that because I don't want him to like, be mad at me, or, and I'm like, well, that's not what if you don't tell him the truth, then you're not going to know, he's not going to be able, he or she's not going to be able to help you. And so I think building that trusting relationship is amazing. And the fact that they can reach out to you and that you give them an emergency plan is phenomenal, because that's another, worry that I see patients have a lot, that they're like, okay, well, this is happening, I have this treatment, but when I go back home, like if they're in the hospital, what's going to happen if I have a flare up or I have an emergency situation? Then what do? I don't have any resources. But it's nice that you give that to them like up front, so they feel a little bit more comfortable. Like, okay, I have plan A and plan B.
Yeah, that's essentially what I feel was really lacking in 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 care delivery systems. Um, with this type of pain, this type of regional pain, and a lot of it is that, as you stated, it's having a relationship with your
Yeah.
physician where you feel comfortable. And I would be remiss if I didn't say, specifically working in this area, of the body, there's a lot that goes along with it. You know, and that's another really gratifying and fulfilling aspect of my job is when I can help patients to reconnect with a part of their body,
Sure.
um, that has not only physical, but also very much emotional significance to their life and their relationships. It patients, I often tell patients, listen, I'm going to, focus on this area of the body, and I'm going to look at the functional and anatomical aspects and take that into consideration. And we're going to treat this part of your body, and there are emotions and sentiment that goes along with the pelvis, and there can be feelings of shame that are associated. There can be feelings of disappointment or letdown with regard to relationships, and that has to be taken all into account, right? So it's funny, like so I don't want to say funny, but it's very interesting and sometimes difficult to thread that needle to say, listen, I'm going to work on this part of your body, and we're going to treat it like any other part of the body that is not functioning properly. But at the same time, we have to. I really have to remember and work with my patients and work with my staff to say, but it's not just like any other part of your body, because you have a relationship or a connection with yourself and with others that often includes this portion of your body. So, and patients often come in where there's been such dysfunction and such pain for so long that they've turned away from that aspect
Sure.
of the uh, and that makes them feel ashamed, and that makes them feel inadequate, um, and being able to give them some relief and some restoration of all the different functions of the pelvis, whether it's gastrointestinal or gynecologic or urologic, and giving them back that functioning, but also giving them back that sort of sense of control and or enjoyment or use of that, of those different systems, in a way that they feel that they're living a fuller life that they weren't able to live before. Super gratifying. It's one of the main reasons why I do this.
That's amazing. That's amazing. So, are you able to see? I know you had mentioned virtual. You do offer virtual visits. Is that correct?
I do. I do. I offer virtual visits. There's a bit of a caveat in that, due to certain laws, I can only offer telehealth visits because where I'm
Sure.
licensed. So I am licensed in the state of Maine, New Hampshire, and Vermont. For patients who are in Canada specifically, I am able to offer telehealth visits for patients in the circumstance where they're not able to access comparable or reasonably comparable care within their province. So,
Wonderful. I do have quite a few Canadian clients, and that often is the concern. So that's wonderful that you have that. You offer that option to them, because it's much
mhm.
needed for sure.
For patients who are not in Canada or New Hampshire or Vermont, or Maine, I'm happy to do a record review and give it an initial kind of like meet and greet, hi, hello. I can't give specific care as previously stated, or specific recommendations or referrals or write prescription, but I can say, hey, listen, I think that I can help, and it might be reasonable for us to find a way to meet, and then we can work out the logistics of that.
That's amazing. That's
And I might actually be expanding my state licensures to at least allow for telehealth visits, um, specifically looking at Florida, considering Pennsylvania as well. But my website, www.necph, or New England Center for Pelvic Health.com, will have that information as it becomes as it is available and as it changes.
It's amazing. Thank you so much. Is there anything else that you wanted to mention that I didn't ask? Anything else that we missed?
I think we've covered some pretty good ground here. I think we covered most of it.
Well, Thank you again for joining me, and thank you for allowing all of our listeners to meet you. Please reach out to Dr. Lucas or myself for any further questions, and enjoy the rest of your day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.